Well, Gaston County workers are now getting their temperature checked when they head inside of a county building. We've seen this at restaurants and really all over. But with so many asymptomatic cases, people who are positive but might not have a fever, we wanted to know how effective this screening method really is. Channel 9's Ken Lemon spoke to health workers about these steps and how safe buildings are once you walk in.
I went through that screening process this morning here at the County Human Resources Center. I got this green sticker which allows me to go into any county building for today. It confirms that I show no symptoms, but it cannot say if I am COVID positive. They walked us through the process today.
Have you been in close contact?
First, employees must answer questions about their health. Then they're moved over to a machine that takes their temperature. If it's normal, they get the green light to continue. If they fail any of these steps, they go home. There are steps that make Julie Wagner happy.
We want to live.
She keeps her face covered even outside and wears gloves. The entire building isn't open to the public. Only employees are screened, not visitors. The Human Services Center is one of few county buildings where staff and the public share at least a lobby. Wagner has pre-existing conditions.
It would be really hard for me if I got this illness.
Last week, we learned of 570 cases, an epic outbreak at a Tyson chicken plant in Wilkesboro. They were conducting similar screenings, but most of the infected were asymptomatic. The assistant director of emergency medicine for Piedmont Medical Center said she's seen this before.
So obviously there's going to be people that slip through these cracks, but this is the best we have.
She said despite the flaws, there isn't a better way of screening right now, and detecting a low-grade fever can make a major difference.
One person has the potential to infect 25 to 50 people, and if we can identify somebody before they can do that, then it's worth it.
In about another 2 weeks, the public will have access to these buildings the way they did before the pandemic. Even then, Julie Wagner says she will wear her mask anytime she's in public. Back to you.
Thank you, Ken. The ACLU is chiming in on this. They say they as a group are concerned about the ways businesses are screening workers, like those cameras, thermal cameras, or a temperature gun. They say, first of all, they're concerned about effectiveness, that experts, they say, don't agree that temperature screening is effective or even useful in detecting COVID-19. And then they're concerned, as always, about privacy. They say your body temperature is not something you would want a company to know or even the government to track. They worry that this could lead to the tracking of other medical data as well. And we've seen that story out there, too.